Just over a year ago, COVID-19 began gaining momentum, spreading across the U.S. March 6th, Oklahoma's first positive case. Less than a month later, elective surgery suspended as hospitals braced for the impact of the virus. And since COVID hit, our hospitals, our lives are not the same. 2 Works for You's Brady Halblab looks at how COVID-19 affected Oklahoma hospitals through the past year and at their new hope for when life may return to normal.
COVID-19 led to hundreds of thousands of deaths across the country, straining hospitals to their breaking point. A call of duty many doctors never expected. Among them, Oklahoma's Dr. Carlos Cabrera, a physician on the front line of the pandemic right from the start. As he reflects on the chaos over the past year, he's hopeful that one day this pandemic will be behind us.
It was really hard for me to believe that there was a virus out there that would do such a damage.
We first met Dr. Carlos Cabrera at the height of the pandemic as he graphically showed the struggle doctors had finding hospital beds for COVID patients. A far cry from his original skepticism that a virus originating in China could make its way here to Oklahoma.
So I remember the very first one we had here was a big deal.
March 6th, 2020, Oklahoma's first positive case, quickly followed by lockdowns, masks, and uncertainty. Then the concern over hospital capacity here began to grow, especially after reports of overwhelmed hospitals in New York City.
And then all of a sudden, September came along, October, and we're seeing more and more and more people.
To cope, on October 20th, Governor Stitt announcing a 4-tiered hospital surge plan, just as hospitalization rates reached an all-time high.
We're seeing an uptick in our hospital counts across the state.
We are headed in the wrong direction.
In November, that urgency revealed here in this video inside of Integris Health's COVID unit.
Hospitals are getting fuller and fuller and fuller. The ICU is full at all of our facilities.
By December into January, the entire state in phase 3 of the hospital surge plan. On December 29th, 1,927 people hospitalized with COVID-19 and 499 in the ICU. The virus putting a strain on the ability of hospitals to find beds for the sick.
About 90% of our ER was full, just holding patients that were admitted. And I remember clearly we kept getting ambulance after ambulance after ambulance after ambulance.
During that struggle, Dr. Cabrera sharing this note on Facebook. Those are the number of available beds across the region. And just weeks later, a ray of hope, the vaccine. The first doses of the Pfizer vaccine making its way to Oklahoma.
And then we started vaccinating, and all of a sudden, cases started drastically dropping.
Oklahoma seeing an 86% drop in cases since January, a trend Dr. Cabrera attributes to the public following COVID-19 safety protocols, including wearing masks without a statewide mandate and the arrival of the vaccines.
I'm very encouraged about what's to happen in the near future. Keep doing what we're doing. We're on the right direction, and hopefully soon we can completely get back to normal life.
And that's welcome news for hospital staff. Still, health experts are urging the public to remain vigilant as we need about 75% of the people to be vaccinated to reach what is called herd immunity. Brady Halblab, 2 Works for You.